Our pre-health program is designed mainly to make sure that students who have a passion for helping people in a healthcare profession can find the right fit for them. One thing that I think we do really well at Shenandoah is that in the first 2 years of their program here, they get to look around and see what that array of careers are, how it best fits into what they're looking for. They get to meet professors in these different areas. And I think that more than anything is the most important thing our program offers. As students begin to get a better sense of where they want to go in their careers, we offer them the chance to work alongside a healthcare provider in a shadowing experience that is pretty unique, because there aren't many undergraduate programs that give students at that level the opportunity to actually be on site and working alongside a healthcare professional.
Shenandoah is a very high-touch university, so students will interact very regularly with their faculty members in their classes. They do a lot of collaboration with their peers and peers who are also seeking careers in healthcare. Shenandoah has an early assurance pathway that students who are high school seniors can be considered for if they meet certain criteria. And essentially the early assurance pathway condenses their undergraduate coursework into a shorter amount of time to get them to the respective healthcare field sooner. And then we have the articulation pathway with our graduate programs at Shenandoah. And every year, our graduate programs reserve a certain number of seats for our students in undergrad who are completing their bachelor's at Shenandoah and meet a certain set of criteria.
I am a part of the articulation pathway, which I think is perfect for those students who know what they want to do, but also want the full 4-year college experience. I have to maintain a certain level of requirements like GPA, getting a certain number of shadowing hours, letters of recommendation. And with the articulation pathway, this is really nice, because if you meet those requirements, you are selected for an interview, because each health professions school holds a certain number of seats for undergraduate students.
And then we have the traditional pathway, where students might come in not knowing what they want to do, and they figure it out their sophomore or junior year and decide to go on to graduate school.
I spoke with an admissions counselor, and I asked her which is the best route for me to take if I want to help people and I don't want to be too restricted to one certain focus. So she said, I think public health would be great for you. You can try a bunch of different things. And so I applied for public health. I took my first intro to public health class, and I fell in love with it because there's just so many different topics that you can dive into, such as nutrition, women's health, epidemiology, and I've been able to really branch out since I got here.
Everyone here is so supportive. What I love about SU specifically is that it is a small university and the professors know me by name, they know my interests. With class sizes being 25 students or under, I'm able to participate in class by asking questions or being involved in discussions, and you just wouldn't be able to get that kind of experience at a big institution.
Our pre-health program is focused very much on making students competitive, not just when they move into graduate school, but when they move to the job market.
I know that if I wouldn't have started this program, I wouldn't have been able to do undergraduate research, which has made me a really strong candidate for grad school. There are so many different classes that you can take. There are so many different programs that you can reach out into.
We have students who've gone into veterinary studies. We've had students who move from health practice to health research. In our program, as we work with students, our primary focus is on making sure we understand what the goals and aspirations for each student are, so that we can find the right pathway for them.